I treat migraine early because it works better. Why does it work better? The longer a migraine attack persists, the more the brain becomes excited. And the nerves inside the brain become excited. And triptans only work early in the course before we have this phenomena of central sensitization. Treat early and get a better result. When does one use preventative medications for the treatment of migraine? 1, acute medicine doesn't work, is overused, or not tolerated. 2, patient preference. If you're a neurosurgeon, you don't want to get a migraine attack. 3, the presence of 4 migraine attacks per month, which is a risk factor for chronic migraine. The presence of unusual or disabling attacks that don't come under control with acute medicine. That's when patients need prevention. Most of the drugs that we have treated patients for migraine have been derived by accident. Patient had angina or hypertension, they got a beta blocker, and it worked for migraine. So the older drugs that we used, like beta blockers, antidepressants, those were based on the use in other disorders. The anti-epileptic drugs, patients with epilepsy who had migraine, their headaches got better. So based on the fact that patients getting these drugs, another indication, got better, trials were set up and they were approved. So that is how the older drugs were developed. Now, we know a lot about the mechanisms of migraine. We know about CGRP. Based on that concept, we've developed small molecules and antibodies against CGRP for the preventative treatment of migraine. During a migraine attack, CGRP levels go up. If the migraine attack is treated with a migraine-specific medicine like sumatriptan, the levels go down. If you infuse CGRP in a patient with migraine, that can bring on a migraine attack. This strongly suggests that CGRP was involved in the cause of a migraine attack. Based on that, drugs that antagonize CGRP were developed. This is an exciting time in migraine. The FDA has approved 3 monoclonal antibodies for the preventative treatment of migraine. The first was against the CGRP receptor. The second 2 were against CGRP itself. Awaiting FDA approval is another drug in the antibody class against CGRP itself, and that will hopefully occur soon.